Fred, what's up?
Oh,
There you are.
thank you for taking my call. I had surgery for my cataracts about 2 years ago,
All right.
and everything was clear. But then I developed what they call the post-capsular
Oh,
opacification.
it's called
Yes,
opacification. Yes.
yes. How is there any natural way to correct that? Because they tried it on my right eye with laser.
That's yeah.
It looks like it did something, but not enough. And then they don't want to work on my left eye. Is there any natural way to cure that or
Well,
correct that?
okay. Here's what happened. Okay, when you remove a cataract, okay, the cataract is a jelly of a sort that over the course of time will harden just a little bit, but it sits inside a capsule. So it's almost as if you had a baggie, or a balloon that was filled with jello. And so the jello started to harden, so they went ahead and sucked the jello out of the balloon, but left the balloon intact. Well, the balloon is supposed to be clear. In this case, it started to change color. It started to turn white. Okay, so it's not something that's unheard of. In fact, if you do enough of these things, you're going to see this happen maybe every third time. Okay, so what they typically do is they'll go ahead and they'll use a laser to cut a hole in it to move it away. Okay, and this is typically done, and people don't have any sequelae of it whatsoever. I'm curious to know why they don't want to do the second eye, though.
They say it isn't worth it or something.
I don't know about that. I would be looking for a different ophthalmologist, okay, and find out whether some a better way to go about this. Because doing the laser to open this up is exactly the right way to do it. Now, with regards to natural things that you can do to help this, there are a bunch of them. The most important of which is called taurine, which is spelled Taurine, which is an antioxidant that you should have taken, which actually and generally prevents this problem. Taurine was investigated by the Chinese and the Indians to treat what are called senile cataracts, which means cataracts of the elderly. Okay, and they found that in dosage of 1,500 to 3,000 milligrams daily, it actually reversed the cataract formation. So that would have been real useful before the surgery, but afterwards, it's not going to do you any damage to do it. Okay, and I would encourage you to do it. But I would also encourage you to find another opinion and somebody who might be able to get in there and get this thing opened up. We're blessed here in Florida that actually down in Miami at Baskin Palmer, these guys are the best in the world. So if they were my eyes, I'd be heading down to Miami to have this done.